Welcome to the Holistic Health Bites podcast. I'm your host, Andrea Nicholson, crime scene investigator turned functional health investigator. This podcast is here to share bite-sized episodes and unique interviews on a wide variety of health topics to empower, enlighten, and educate you to live your best, most vibrant life. Disclaimer: all information you hear on this podcast is for information only and constitutes individual opinions of the person speaking. This should not be taken as medical advice. Being a listener of this show does not initiate a practitioner-client relationship between you and the hosts or panelists on this show. Please discuss these topics with your medical professionals before making any changes to your health. Okay, let's dive in. Welcome back to the Holistic Health Bites podcast. Today, we are going to talk a little bit about sports medicine and a really interesting transition with my special guest, Dr. Dustin Vaughan. Thank you so much for joining us today.
Hi, thanks for having me.
Absolutely. Will you just kind of introduce yourself, tell us a little bit about your story and how you went from firefighter to integrative practitioner working in sports medicine?
Sure thing. Okay, so I was obviously a firefighter. I spent decades in Western medicine and now Eastern traditional Chinese medicine. Basically, I tell people that I figuratively and literally got tired of putting Band-Aids on people. I made the transition because a lot of the senior guys that I was working with, unfortunately, people don't realize the risk versus benefit analysis that firefighters have to go through on a day-to-day basis on whether or not the job is worth it, because it does take its toll on your body. So I was looking at other colleagues of mine that were firefighters and paramedics, and they were making a transition into PA, so physician's assistant. I think now it's dubbed as physician's associate, still PA. But they were all making those transitions and looking forward to going to different schools to do that, where I was considering what I wanted to be when I grew up, and was looking at different opportunities and options. PA school was one of them. Nurse practitioner was another. But I remember that I had great experiences in acupuncture in years past, helping me through my sports-related injuries. And I chose to go that route because as a acupuncture physician here in Florida, I'm a primary care, so PCP. I can do the scope of practice is pretty broad. I can do a lot of really cool things, which we'll probably talk about here in a little bit. But that's how I chose acupuncture. I had really good experiences. They helped me when other doctors couldn't, and they were able to get to the underlying cause and fix that, which of course helped my symptoms to go away, which was kind of my theory and my methodology for treatment.
Oh, that's so cool. I think so many of us get into our respective fields because of our own health transition. So it's not surprising that that was also true for you.
Oh yeah, absolutely.
Yeah. And I worked in forensic science for 15 years. So I also understand the stress of other careers and why you might make a transition from a stressful, difficult career into something more positive and helpful and happy and all the things. So I think that's
exactly.
We have similar stories from different career fields, but yeah, absolutely. So what are some of your favorite things that you really like working with, or your favorite techniques, or do you have a particular kind of injury that you really like to work with?
Well, I see a lot of back pain because that is pretty much a number one complaint, I would say. A lot of people have low back pain, mid back pain. I do work well with that. I've helped a lot of people with sciatica and low back pain in general. However, I do see so many people with joint pain, like shoulder pain or knee pain. And I talk about those three things really a lot. And I can do some really cool things with them. From acupuncture is obviously one of many modalities that I have to treat. I do a lot of injection therapies. They're all natural. They're plant-based. And those injection therapies help to suppress things like arthritis, arthrosis. There's just a lot of types of itises and osises that I can start naming off, but most people don't care. It's just inflammation, right? So when we're talking about that inflammation typically causes pain, and that causes a hindered movement. So my grandfather both of my grandfathers actually kind of steered me into the path that I chose. One of my grandfathers, he hurt his back doing something as simple as pulling his Western style boot on. Hurt his back. That back injury unfortunately caused him to live a sedentary life. And that sedentary life, unfortunately, that's what we talk about a lot, is that movement is medicine. So he wasn't able to move because it hurt. So unfortunately, a lot of health conditions started to pile on. Of course, he was taking lots of different medications, and those medications had side effects. And then some of those side effects, unfortunately, caught up with him, and he's no longer with us now. But if I was in a position that I am now, where I could have helped him to maintain that movement and continue to move, because he was a very active person, him and my grandmother both, then I don't know, but I may have been able to prolong his life or help him to navigate a smoother, healthier life.
Yeah, absolutely. Losing physical capabilities is such a major factor in declining age or declining health as we age. It makes such a big difference when people lose their ability to be active and do the things they want to do.
Yeah. And I guess I'm sorry if I didn't answer your question properly, but yeah, I do see a lot, and I do enjoy working with knee pain and shoulder pain as well as low back pain.
Yeah. So what are some of the things that you see people are doing in their daily lives that are maybe causing some of those ailments or issues?
Ooh, that's a loaded question with a
Yeah.
complicated answer. So there's I do have a real conversation with a lot of patients because when I did get my doctorate, I went back and I was diving into research and doing a lot of what I needed to do for the program, but I was trying to focus on the things that would be most relative to me in my practice. And something as simple as we talk about knee pain. There's so many people in America that have knee pain and knee problems. One of the things that I'm real with patients about is that 10 pounds of body weight alone, just 10 pounds of weight, if you were to lose that 10 pounds, that's 40 pounds of force on your knee. So if you multiply that, you're looking at maybe you need to lose 20 pounds. Now that's 80 pounds of force. So,
Yeah.
and this doesn't have to be a short-term goal. It can be a long-term, a marathon, not a sprint. But that's something that's very, I would say, common in a lot of people because, we could all probably fare to lose a few pounds.
Yeah, that's a big one. And 10 pounds, that doesn't seem like that monumental of a goal. And yet that's a huge impact. 40 pounds or 80 pounds if it's on both sides, like that's a lot.
For sure. Yeah, it's
It's gonna
40
make a big
pounds of
difference.
force on your one knee. And I have research to back it up on peer reviewed from
Yeah.
PubMed.
Yeah.
And I tracked down, there's just a lot of really cool things. So I did a presentation on that in my doctorate program on just that simple fact of, most people, to alleviate some of that pain, it's 40 pounds of force. I mean, if you already have a bad knee or your knee is causing you issues, then that's a significant reduction in pain and probably a healthier, easier movement.
Yeah, for sure. I mean, I think anyone who's ever actually lost 40 pounds would know that just from the weight loss that their whole body feels different. But even 10 pounds makes a huge difference. That's so amazing.
Yeah, for sure.
So, what are some other things? Like, I know you mentioned people being sedentary, and obviously, a lot of us are now computer workers and we sit all day long. Are there other things that contribute to, we have poor posture, we cross our legs, like some of these things, are those also contributing a lot to this?
Oh, absolutely. I talk a lot about that. I talk a lot about the anatomy and the anatomical positioning of how your computer desk is, where your mouse is, carpal tunnel syndrome, low back pain because of the way you're sitting at your computer desk. Maybe it's not the right chair for you. Maybe it's not the right height for you, whatever. I talk a lot about that. But another very important position that we're in, hopefully for 6 or 8 hours a day, is sleeping.
Mm,
And the way you sleep and the way you're positioned while laying down, there's several positions. Some people are stomach sleepers, side sleepers, or back sleepers. I can pick apart every single one of the positions. There are some different techniques and tricks that we can do to help to alleviate some of that stress on our low back when we're sleeping, or on our shoulder when we're sleeping, or even your neck. So that's where I talk a lot about with patients. And I would probably say 99% of them, how do you sleep?
right. Oh, it's such a big deal. And so many people, like their biggest pains or their biggest injuries come from sleeping.
Mm-hmm.
You wake up sore, you can't turn your head. Like it's crazy that you can get so messed up sleeping. Like,
I have a patient of mine that tore his shoulder sleeping.
oh, geez.
So
Yeah.
there's lots of things can happen.
Oh, that's nuts. So what are some things that people can do like throughout the day? If you have a computer job or, a pretty sedentary day job, what can you do to kind of minimize some of those things? Obviously having your computer set up and those kinds of things that you mentioned, but are there stretches? Are there exercises? What can people do?
Well, I mean, just simply put, just movement. I mean,
Okay.
try to make a break, try to get up every hour, try to get up and move around a little bit. Maybe it might mean, do some push-ups, maybe do some sit-ups, maybe just walk around the house. just something as simple as that. Some people aren't inclined to do those couple things or light exercises, but at least get up and move around, because sitting, what was there's something new, a new phrase that people were now saying, that, sitting is the new, I'm sorry, forgive me, because I can't remember the saying, but it was bad, basically,
Yeah.
meaning that, it's the new terrible thing to do is sit. And people are realizing that, because the sedentary life and the sedentary, work life, unfortunately, we all have to do that. But if you can get up and just move around a little bit, get that blood flowing a little bit, because that's going to help you.
Yeah. Yeah. I think it's something like sitting is the new smoking.
Yeah, that's what it was.
Something like that, where it's like,
Thank you.
it's such a innocuous thing, and yet it has a tremendous impact in your overall health. And so many people think exercise is just about like being fit and ripped and strong and all the things. And yeah, of course that plays into it. But if you can't get up and move because you've lost your physical capabilities, your knee hurts too bad, your back hurts too bad, like that's changing your entire life. It's
For
not
sure.
just about being ripped.
Absolutely.
But also having the muscle is also protecting your bones. It's managing your blood sugar. Like there's so many other factors that play in. This isn't just about, being physically capable to like play sports. This is literally
absolutely.
your life.
And the misconception is you don't have to go to the gym and pound a bunch of heavy weights. You don't have to be that big, strong guy.
Right.
Some people want that, and that's okay. But as far as just maintaining some overall like skeletal muscles and some overall muscular health, I guess, because as we age, things atrophy, and if you don't use it, you lose it. So something simple that like rubber band work. There's lots of different things on the internet. I say YouTube is a great source, but it can also be detrimental if you pick the wrong person and follow them and do something you shouldn't. Then you're going to come see me because you hurt yourself. So I tell people that, there are little things that we can do. I'm not a physical therapist. I was a personal trainer. I have worked in fitness and the fitness realm. I was a coach, a running coach, and Olympic lifting. So I've just done so much, and I was an athlete myself. And I have a lot of things that I can help people to just navigate that shoulder health, because a lot of times, unfortunately, as we age and we don't use some of these shoulder muscles, we don't work out, we don't do something, simple little exercises that can help to maintain our shoulder girdle stability, and that'll keep things where they're supposed to be, because your shoulder joint is literally held in place with muscles. And if those muscles atrophy, then your shoulder joint could be compromised, and then you're sleeping in an awkward position. That's another compromise, and so on and so forth. So there's just a lot of things that can help us just by maintaining just a little bit of movement, a little bit of activity. Doesn't have to be an hour-long session at the gym. It could be something as simple as 5 or 10 minutes at home here and there.
Yeah, I think that's a really simple tip that people can really take away is, set an alarm and get up and just move for a couple minutes. Stretch, walk, go up and down the stairs, do something, but just, it doesn't have to be this big formal thing. You don't have to join a gym and drive across town and hire a trainer and do all the things. Just move, just be active.
Absolutely. I remember, years ago when I was a child, I remember my grandmother with soup cans doing some, exercises in the kitchen. So, I mean, that's all you have to do.
Yeah, absolutely. And you don't even have to lift anything. You've got your body. There's so much you can do with just your body. Just move. Yeah, I think that's a great tip. Are there other like mistakes that you see people making, either in trying to repair an injury or, get stronger, or just things that people are doing in their, everyday lives that are contributing to the decline of their physical body?
Well, I'd say that a lot of people, the internet, like I said, is a great source of information. However, it's also a bad source, because some people will find something, you'll Google search back pain, or you'll Google search and you'll find exercises that might help you if you had a specific type of back pain or a specific issue that was causing your back pain. However, if you're starting to do things and self-prescribe exercises and self-prescribe, you can actually do more harm. And I don't want to see people get hurt, and I tell people, if it hurts, don't do it. It's not that kind of pain you want to push through. Our minds are sometimes stronger than our body, and that's where we have to be careful. Doing certainly the exercises that we might find on the internet. Like I said, YouTube is a great source of information, but it can also be detrimental if you do something you shouldn't.
Yeah. I think that's so true in all of the health fields. I mean, you can certainly Google nutrition information or supplement information or medicine information and do way more harm than good. Just
Oh,
because you find it
absolutely.
online does not mean it's reputable. So I think that's good advice, regardless of what you're looking up. And that's probably true in things outside of health as well. Like we really do have to take the source into consideration when we're taking advice from a random person on the internet.
Yeah,
And
absolutely.
even a credentialed person. Like there's people who have, PhDs or doctorates or whatever, and they have a bias behind what they're saying, and it doesn't necessarily mean it's the right advice for you. So definitely use caution when finding stuff on the internet.
Absolutely. If it's on Google, it doesn't mean it is true.
Yeah, absolutely. Yeah, you can find a million opinions on Google, and there's probably a lot that are more harmful than good. So, in your work, do you have a clinic? Do people exclusively come see you in person? Do you also work online? How does your business work?
So I am in person.
Okay.
It's hard to do movement screenings and neurological assessments and ortho assessments online. It can be done, but it's difficult. I do everything in person. There was a time that I was doing telehealth visits, and those are just for sick patients. I still do those every now and then because I do specialize in sports medicine. I am trained, classically trained, I say, but I'm trained to treat everything.
Yeah.
However, my specialty is in movement and mobility, sports medicine. I tell the misconception with sports medicine, first off, is that it's only for athletes, and it's not. It's for anybody that has pain upon movement. If it hurts when you move it, that's where I help. I do see a lot of athletes. I do see, professional athletes and Olympic athletes, but I do see also the octogenarians and the geriatric patients that just have knee pain that's limiting what they can do.
Okay.
But yeah, I only see in person because it's really hard for me to, give an acupuncture session or injection therapy online.
Yeah, absolutely. You do kind of have to be present for those needles. Yep. And where are you located?
I am in Claremont, Florida.
Okay.
So I'm just about 25, 30 minutes west of downtown Orlando.
Okay.
A lot of people know where Orlando is, so that's why I
Absolutely.
use that as a landmark.
Yeah. So, for everyone who doesn't maybe live near you, can you give any advice or recommendations to maybe find someone that does work like you do, or that can help them with whatever their physical ailment is in their local area? What their questions they should ask or certifications they should look for?
Um, well, basically, so if you're looking for an acupuncture physician, then you can go on NCOM's website, NCCAOM. You can click on find a provider and hopefully find someone nearby. Then you want to probably look at their credentials, see what they do. And it's all based on what you're looking for, really. But if you're looking for somebody that's going to help you with the things that I do, then try to find somebody that has a sports background. Try to find somebody that has an athletic degree or something that's going to help them to help you better. But NCCAOM is going to at least give you a diplomat of Oriental medicine or a diplomat of acupuncture that is credentialed in that way, that you can find them that way.
Okay. Yeah, that's great. I think, that's much better than just Googling. So having, at least a reputable source to go to is a big help for a lot of people.
A lot of people nowadays are using things like Facebook
Mm-hmm.
to find a provider because they ask questions and hear from their peers. And
Mm-hmm.
sure, that's a good resource, I guess, to use.
Yeah, it certainly works, especially if you have a personal recommendation. But it's not all that different than Google, where you can also get not so healthy advice on social media.
And there is a difference also when you're looking at acupuncture and dry needling. That's a common misconception is when
Yeah.
people see their chiropractors, they think that they've gotten acupuncture because
Right.
they call it acupuncture. Well, they have a certification in acupuncture typically. So I don't want to dime them all out because some of them have gone through a traditional acupuncture school and they come out as an acupuncture physician and a chiropractor. So there are some of those. There's not many, but there are some. But typically dry needling is much, and I want to tell people that the dry needling is completely different than acupuncture because they're both useful. Dry needling can help. However, acupuncture works on your nervous system, and acupuncture does a lot more. That's where I can treat something like low back pain from points on your ankles and your wrists,
Okay.
as well as your low back. But people don't realize that. I get people on the table, they get going, they may have had acupuncture, quote unquote, big air quotes there, from their chiropractor, and where they had 80 hours, maybe at the most 200 hours in acupuncture, needling, where I have 2,500 plus hours,
Wow.
and I'll get them on the table, and I've already explained how acupuncture works, talking about the meridians, talking about how the body works and the nervous system works, and then I start with things on their ankle, and they're like, "Hey, it's not my ankle, it's my low back that hurts." And I have to remember, we just talked about that. And these points are actually very influential for your low back. It's almost like I'm priming your nervous system before I actually work on your low back. And they're like, "Really?" It's like, "Yeah." So basically, these points send a signal to your brain that then sends a signal to your low back that almost prepares your body before I actually get in there and start working on your low back. I'm like, "Wow, that's so cool." Okay, that's exactly the difference, right? So
Yeah. It is a big difference. And I definitely think there's a lot of misconceptions around dry needling and acupuncture and what the differences are and, what the benefits are for one over the other, or, all the things. I think a lot of people do think that they're the same, but clearly they're not.
for sure.
So is it just a difference in training level, or is it actually, are the needles different? Are the placements different? Like the two techniques?
Yes and yes. So
Okay.
the training is different. Obviously, I had 2,500 plus hours in acupuncture, learning the points, learning what they do. Each point actually has an indication. So there's a traditional number of points. It's about 350 points, 400 points on the body. Each one of those points have an indication, just like a pharmaceutical medication would have an indication. They also sometimes have contraindications. So they also have to look at anatomy. What's the anatomy behind the point? Where's, is there a vessel back there? Is there a lung back there? So there's all these different things that we need to know about the points alone. So that's why there's so much time invested. Whereas to get a certification to do acupuncture by chiropractors and as in physical therapists are about, I want to say 80 hours. I think it's like a 4 weekend course,
Okay.
if I'm not mistaken. So the amount of time is obviously much less. They don't get the time to understand the points, understand what things do. They just know that. And I'm sorry, I haven't taken one of their certification classes, so I'm not exactly sure what's
Yeah.
all in it, but it's only 80 hours. And in that time, you have to also learn how to place the needles. So I would assume that, you're not going to get into the depth and the of what the points do and how you can help the nervous system.
Yeah. Yeah, that makes sense. That it's a completely different thing. And
For
yeah, it
sure.
would make sense that you haven't gone through their training because you have much higher level training.
Right.
Very interesting. Yeah, it's definitely a modality I don't know a ton about myself, but I know so many people are tremendously benefited by acupuncture. So I definitely think it's a modality that everyone should look into, especially for pain, but also for, not necessarily in your world, but anxiety and depression and kind of the mental health side of things. I know so many people have been so tremendously helped by acupuncture. So I think finding a reputable, well-trained, highly skilled practitioner is always recommended, no matter what modality you're looking for.
Absolutely. I work synergistically with mental health counselors at times, chiropractors, physical therapists. We do work very well together and we have a great working relationship. It would be great if we were all under the same roof, but we're not. So we actually have to go from building to building, but it is very, very complementary as far as the different treatment, like the different treatment plans and everything like that. So
Yeah, yeah. There is no like one system that's going to work for all conditions, all people. So I think having that complementary relationship is a really good thing, so that you can get the benefits from all the different modalities, and the likelihood is you won't get all the different modalities from any one practitioner. So being able to kind of find that team of practitioners that can cover all the bases is really important.
absolutely.
Awesome. Well, any other kind of parting words for everybody before we wrap this up?
Well, I know we were talking a little bit about it, about different injection therapies that I do. That sounds like a daunting tale. Most people hear that and they get scared. They've had cortisone shots, or maybe they've had other injection therapies that may or may not have worked. And unfortunately, those tend to be a little bit painful, or a lot painful. I do all of my injection therapies are natural. Everything I do is either natural, homeopathic, nutraceutical, vitamins, minerals. I do have an IV lounge as well. Again, everything there is minerals or vitamins, nothing synthetic, nothing pharmaceutical. With the cortisone shots, a lot of people that have had those shots, they know that some of them may have gotten some relief, but it does come with a side effect. And some people know of those side effects, those things that can degrade different things like, soft tissue, tendons, ligaments, joints. Whereas my injections are not painful in that regard, and they specifically work on inflammation. So like that arthritis or osteoarthritis, mainly any kind of inflammation. I see a lot of tendinopathies. I see a lot of Achilles tendonitis, you name it. There's just different types of itises and osises, again, inflammatory. But I also have a CEU class coming up on September 9th. I've been trying to keep these up and running about once a month. So if you're not able to come to the September 9th one, but you want to get in on one of my Acupoint injection therapy for sports medicine classes, then just keep an eye on the website, keep an eye on the postings, and you'll see as we continue to roll out more and more classes throughout the rest of the year.
Oh, that's awesome. That's a great resource for anybody that wants to, stay up on this stuff and get those continuing ed credits. I think that's a fantastic thing that you offer.
Absolutely.
Awesome. Well, we will definitely link up all of your information in the description. And so people can just easily click over to your stuff and find out more about you and all of the things. So thank you so much for sharing your wisdom with us today, and just all the information on where people are going wrong and what their options are, and that, there's hope. There's hope, and you can do simple things. So thank you so much.
Absolutely. It was a pleasure. It was a pleasure being here. It was a pleasure talking with you.
All right, everyone. Thank you so much. And we'll catch you again on future episodes. Thanks for being a faithful listener to the podcast. I'd love it if you left me a 5-star review on this podcast so that others can more easily find this valuable information. Did you know I also work one-on-one with clients? I approach solving health challenges like I approached solving crimes, by conducting a thorough investigation into your case. Sadly, hundreds of millions of people in the US have insulin resistance, prediabetes, and diabetes, and the vast majority have no idea. I'm here to fix that. If you struggle with low energy, stubborn weight, hypertension, sleep disturbances, or any other undesired symptoms, let's talk. All you have to do is schedule a free call. The link will be in the show notes. And no, you do not need to live near me.